So the key is seeing a provider who does this in a regular way. You can take a course over a weekend and start injecting Botox or Dysport, but are you going to be doing that well? It really takes years and years of experience. A lot of patients ask about the differences between Botox, Dysport, MyoBloc, Xeomin, and the answer is these agents are very, very similar, but these agents really are tools. They're tools that we use in an aesthetic practice to achieve goals. And we may use these tools a little bit differently, but the goal is the treatment regimen. The goal is the experience of the practitioner in using these tools. We equate it with a carpenter. Well, is it the wood, is it the hammer, or is it the carpenter that creates that result? Same thing with a piece of art. Is it the paint or the canvas, or is it the artist that creates the result? So with the Xeomin and Botox and Dysport, it's really how you use these agents. Though they have some marginal differences, how much each spreads, when they exactly kick in, how long they last, they're very, very slight. The difference is really how you inject them. We inject Botox and Dysport differently. And I might use Botox and Dysport actually in the same patient for different indications.
So there are two types of lines we see. One type of line is called static, or line at rest, and the other line is called dynamic, or line with motion. So these lines at rest are called static lines. If we use Botox, we're relaxing the muscle that caused those lines, but we're not actually treating the skin creases. For that, we use dermal fillers. So our plan today is to use a dermal filler to fill in the lines. We're going to use Restylane Silk today, and then we're going to use Botox to slow the muscle down, which is going to help us get a little bit of a brow lift.
After injecting Botox and Dysport hundreds of thousands of times now over the last 2 decades, I'm able to anticipate the needs of our patients. And everyone's needs are different. Their anatomy is different. The goal is different. We may be looking to create a brow lift in one patient or roundness in the eye of another patient. We may have a patient that has thin skin versus thick skin, or a patient that uses their cheek to smile versus the area around their eyes. These are all different and they require different techniques. So it's not so much whether it's Botox or Dysport or Xeomin, it's the technique, it's the experience that really matters. Some people claim that Dysport may kick in a little bit sooner, or Botox may last longer, or Dysport may diffuse a little bit greater. And that's actually probably true, but in clinical practice, it's really the technique and how we use these agents that is responsible for creating the result that we want. And nothing can replace experience. After having injected hundreds of thousands of patients over the last few decades, I can honestly say that experience is probably more important than anything.